What is intracranial pressure? Intracranial pressure is the pressure exerted by fluids such as cerebro-spinal fluid inside the skull and on the brain tissue. Intracranial pressure is normally 7 to 15 for a supine adult. This equals to 9 to 20, which is a common scale used in lumbar punctures. A 19-year-old man is brought to the emergency department after sustaining a traumatic brain injury during a motor vehicle collision. On arrival, the patient is comatose and has a Glasgow Coma Scale score of 3. His blood pressure is 110/70 and pulse is 114. Pupils are myotic, equal, and reactive to light. Ecchymosis is present behind the ear, but the remainder of the trauma survey is unremarkable. Rapid sequence intubation is performed, and the patient is mechanically ventilated. A non-contrast head CT scan demonstrates bifrontal contusions and a basilar skull fracture. 1 day later, a repeat head CT scan reveals diffuse cerebral edema. The ventilator respiratory rate is adjusted to achieve a partial pressure of carbon dioxide level of 26 to 30. Which of the following is the most likely effect of this intervention? The correct answer is D, increased cerebral vascular resistance. The brain has little room for expansion as it is encased in the cranium. A small volume change in any of the intracranial components, for example, brain tissue, blood, cerebro-spinal fluid, can produce significant changes in intracranial pressure. Therefore, even small increases in cerebral blood volume can raise intracranial pressure and cause brain compression. The main factors influencing cerebral circulation are systemic blood pressure and arterial blood gas levels. When systemic blood pressure is 60 to 140, it has little effect on cerebral blood volume because autoregulation via cerebral blood vessel dilation and contraction keeps blood flow constant. Blood pressure greater than 150 increases cerebral vascular volume and blood flow. It is causing a corresponding increase in intracranial pressure. In contrast, blood pressure less than 50 causes cerebral hypoperfusion and potential ischemia. Arterial blood gases also have a powerful effect on cerebral blood flow, with partial pressure of carbon dioxide being the most important regulator. A drop in partial pressure of carbon dioxide due to hyperventilation causes vasoconstriction. The resulting reduction in cerebral blood volume leads to decreased intracranial pressure. Lowering partial pressure of carbon dioxide is one of the measures employed to reduce intracranial pressure in mechanically ventilated patients with cerebral edema. Choice A. The brain has a very large oxygen requirement, about 20% of all oxygen consumed by the body. Induced sedation and therapeutic hypothermia can decrease brain metabolic demand, exerting a neuroprotective effect and improving intracranial pressure by reducing cerebral blood volume. Choice B. The vasoconstriction induced by hyperventilation can cause a decrease in local cerebral perfusion that can worsen neurologic injury in patients with acute traumatic brain injury or stroke. Therefore, hyperventilation should be used with caution in these patients, and the partial pressure of carbon dioxide should be maintained greater than 30. Choice E. The thecal sac is a sheath of dura mater that contains cerebrospinal fluid and surrounds the spinal cord. Increased intracranial pressure can cause displacement of cerebrospinal fluid from the brain into the thecal sac. However, the drop in intracranial pressure caused by hyperventilation reduces cerebrospinal fluid displacement. Educational objective. Carbon dioxide is a potent vasodilator of cerebral vasculature. Tachypnea causes hypocapnia and cerebral vasoconstriction, thereby decreasing cerebral blood volume and intracranial pressure.